Now, let me talk a little bit about what they are. Venous varicosities, which are what varicose veins are, happen because you have a breakdown of the valves in our veins. So I like to talk about things by showing what they actually are. So I made a little demonstration over here. Come on over. This is your vein. Okay? There's the channel going up. Our feet are down here, and our head's up there. The blood goes from your feet up to your head. So you and I are blood cells. Okay. And we're traveling through the walls of the vein, and we're bouncing through. And this is the valve. You see the valve? The valve's open. It's a one-way valve. The valve will go through, pop through here, and we get through, and we're done. Okay? Now, here's the problem. If you've got varicose veins, when the blood comes through, these valves don't shut all the way. So we begin to push on them and lunge them, and they begin to leak a little bit. And as they leak, we can actually pry our way through them. And because gravity is pushing back towards the feet, the red blood cells come through, and now we engorge this area and now push on there. Now we really begin to swell on this and begin to pop through. And this deforms the vein. Can you see that? And that deformation really pushes into that.
Ow.
Yeah.
Oh my God.
Now you're a varicose vein. Now, this is the problem that we run into with varicose veins. Once, now you're all fizzy. Now we can do a hair segment. Now I want to take it back to an animation, because this is really cool. If you understand how these can lead to varicose veins, you'll understand other things that can happen. So let's say you're sitting on a park bench, and look at the vein there. And those valves are opening and closing as the blood milks its way up towards the body. But as you sit, for example, in a position that's not so friendly, or you're standing too long down a Mulberry Street dancing, the valves will snap open, the blood engorges, and like we just did, it pushes on the sides of those veins, and they swell up. And as they engorge, they become these big varicosities, look like worms beneath your skin. Now, the other thing that happens is they release chemicals. They begin to lose fluid, and it causes swelling of the tissue and inflammation of the tissue. So as the tissue gets thicker and thicker, you'll start to get ulcers. Do you see the ulcer there?
Yes,
yeah. What do you think about that ulcer?
That's gross.
It's gross.
It looks painful.
It's painful.
Yeah.
You know, it's uncomfortable to look at, but it's very painful to have. So varicose veins start off with very small little things, like little spider veins. You know, where they don't just beneath the surface. Right. And then over time, if these valves get bigger and you leak more and you push more into the walls, you get ultimately the swelling of the tissue that we're just talking about there, and that can cause those painful ulcers. And when they get infected, as a doctor, I'm telling you, it can be a big issue. Because with all that swelling of the tissue, the immune cells can't get that help out, so the ulcers don't heal. And you spend months, literally, trying to get those wounds to heal. So let's talk a little bit about the risk factors to getting those varicose veins, because if you can address the risk factors, maybe that won't happen to you. Then you won't be able to go dancing with your friends to celebrate their birthday. So you're over here. All right, now we've got 6 different factors here, broken up. Some of them are non-risks. Some of them are absolutely risks for varicose veins. The audience is allowed to chirp, and your friends are welcome to help you out a little bit. All right, what do you think? Age, yes or no? Risk factor or not?
Yes.
The friends concur. The triad concurs down there. Inactivity.
Yes. Because you said stand.
Very good. Family history.
Yes.
If you take a medical exam, always say yes to family history.
Okay.
Even if it's a small problem, it's still your family's fault. You can blame your mom. It's an excuse, right?
Right.
Height.
No. No. Is it?
Oh.
No. Oh, that's not good.
The taller you are, the more gravity. Yep. Height's an issue, so you're good. You're good to say. Race. African American, white.
Yes, it seems to be everywhere. No.
And how about caffeine? Why? Why is caffeine a problem?
It's a drug.
Because it's always a problem, right?
Yeah.
No, but it's not. God, be independent-minded. I just threw that in there. All right, so look, these are the 4 I want you to focus on. You can't change age, you can't change activity levels, you can't change this, but you can't change this. So this is what you're left with. Things you do are what we have to focus on. So come on over here. What can you do to make life a little better for you? Compression stockings, which you've probably never worn because you don't have varicose veins, and they don't look very attractive. Listen, I get it. You don't want to wear these things. They're not very attractive. You're going to feel, matronly, and who wants to be dressed? That stated, you know what? If you're going to have ulcers like that in your legs, you're going to want to wear these. So if you're working a job where you're standing on your feet all the time and people can't see your legs anyway, wear pants, put these stockings under. You want to buy 25-millimeter powered stockings. That means they're actually putting 25 millimeters of pressure on your skin and supporting your leg. You won't get the swelling. The veins won't be able to engorge. They won't dilate up like we were showing. You won't get the pain from that either, and you're good to go. Okay? Second thing, some horse chestnut seed. Horse chestnut seed reduces leg swelling, reduces edema, and for that reason, I think it's worth taking. Remember how I showed the veins were sort of seeping fluid out?
Right.
The inflammatory response, the irritation that happens with that, can be reduced with horse chestnut seed. It's about 300 milligrams twice a day. You can find this in health food stores.
You have problems?
No, if you're having issues. I wouldn't take these if you're not having problems. But if you've got a family history and you're tall and you're getting older and you think you're starting to have issues with your veins, think about this. And finally, hesperidin, which some of you probably haven't heard of. It's a flavonoid. It's found in citrus fruits. Doesn't they smell good? Now, these don't smell so good, but they work. So it has this key flavonoid that's in there. They often in combination with something called diosmin. And they come in 500 milligram daily aliquots. You take the pill. It's very simple to do. Again, if you're having the issue. Right. I'm offering these to you because I want you to have tools that you can begin to take advantage of. Now, if you don't get where you want to be with this, and if you're not willing to wear the stockings, and if you're not going to do these, do me a favor, you sit back and put your legs up. And I'm not talking about in the stool. Your feet have to be higher than your heart, or else you don't have the gravity benefit of the fluid going the right way. If you're not going to do those things, there are surgical treatments out there. They do work. They are less invasive now than they used to be. You know, we don't want to have everyone go out and get those things if you're not having a big issue. So take advantage of these less invasive opportunities. They're also cost effective. What do you think, Leslie?
Yay.
Are you going out dancing?
Wonderful. I'm still dancing.
Thank you very much. Well, and thanks for your friends being here. Be right back.
Thank you so much.